everyone being here tonight. Last time in this place, we had some discussion about overview of dementia and cognitive impairment. We answered to one question. Is it possible we prevent dementia? Is it possible we delay dementia? And even is possible we reverse cognitive impairment and dementia? The answer is yes. And this is overview of our talk. This is the roadmap. First one is going to be exercise. Next one is going to be sleep, and I believe we are changing location. Next one is going to be March 16, Muscatine School, Muskie Room, Mulberry Avenue. Before I start, I wanted to mention a few points. I'm still learning, and whatever I'm learning, I'm trying to translate in very simple way to share with us, with each other. And sometimes you have to make your own plan. With all of those information, we are not providing any action plan, any details, how you exercise, how you sleep, how you eat. You know your strength, you know your weaknesses, you know yourself the best. You make your own plan. This is your plan. Second one, I'm here just give you some perspective. Sometimes some people say, I'm getting old, I'm not exercising. I'm here to say, maybe you're not exercising, that's why you're getting old. I'm here to say, no, you're not sleeping because you're getting old. You're getting old because you're not sleeping well. So we just need to use different lenses. That's why we are here. Regarding exercise, I believe we all hijacked. We all programmed. We are receiving a lot of complex information about exercise. Exercise is not a state of doing. Exercise is a state of being active. Right now they are saying sitting is new smoking. We all designed to be active. Every single part of our biology is going to work if we are active. But unfortunately, they are trying to wrap it around business model. And right now, they are making $33 billion industry. 2028 is going to be $400 billion. Is complex, is expensive, and they are trying to program we end up as a beach body. Nothing is wrong with that. But I'm saying exercise has 700 biological effect on our body. Last one, it's going to be that. If we don't focus on that weight, just we focus on well-being and health, that weight goes away. Do not focus on your weight. Just focus on your memory, cognition, well-being, and overall health. For decades, we were pushing about willpower. We were giving too much credit about willpower. I think we gave too much credit. We have to focus on skill power. Learning. How to learn how to sleep. Learn how to exercise. Learn how to eat. There is a very interesting research. They did a study on housekeepers. They made two different groups. One group, they didn't teach them much. The second groups, they told them, hey, whatever you're doing during daytime, whatever activity you have, has this much effect of your health. And after 6 months, they did lab works on them, who they were taught to do more works affecting health. All of the labs, cholesterol, blood pressure, inflammatory markers, for those groups they were taught was much better. The point I'm trying to make it, skill power, make us, we act better. Information empowering us to do better, more, and efficient. From all of the lifestyle we are going to do, exercise, we have the most data. Exercise is the most proactive things we can do to prevent and even reverse memory. Some studies are saying decreasing risk for dementia by 50%. This is a new data. One simple exercise, deactivating many genes, bad genes, and activating many good genes just by simple exercise. The red one is upregulating good genes, the blue one downregulating bad genes. One simple exercise in overall cellular level and genetic level, see how much effect is on genes. Just simple exercise. And have you ever received any flower box in the mail? During winter time, when you take it out, they are not happy. With a small water, you see dramatically change. Exercise effect is the same. The effect is immediate. In the morning, when I'm waking up, I'm a little bit tired. With 5 minutes treadmill, 7 minutes exercise, you feel more focused. The payoff is that fast. But unfortunately, you have to keep feeding it. You have to charge this parking meter to have a long-term effect. Today, I'm going to talk about 3 things about brain. Exercise, bringing more blood to the brain, increasing your BDNF, and also make communication of the nerves better. 2% of our body is brain, 3 pounds, 3.5 pounds. That gobbles up around 20% of our energy. And 25%, 1/4 of the whole oxygen that we need go to our brain. And heart pumping too much blood to the brain they need. 1/3 of our brain is vascular system. 100,000 miles. Going around equator 4 times. And if you see heart pumping blood everywhere, when you see there is two big veins, 2 big arteries going to the brain. Imagine there are 2 highways like Highway 80 going to the brain, giving all oxygen and all energy to the brain. Exercise making heart strong and heart pumping better. When heart is happy, they are pumping better. They are giving building blocks to everywhere they need. They are sending semi to the highway, building blocks of oxygen and energy whenever they want and they need, and they are making more blood vessels. They are making more energy to all over the body, especially brain. So, if you make your heart happy by exercise, your brain also is happy. If you make your brain weak, your heart is weak. If you make your heart weak, your brain is foggy. They are completely correlated together. They are saying if you want to make good economy in a country, you have to have a good transportation system. If you want to have good health, you have to have good vascular system. And vascular system is the first system affecting our health. How many of you guys have high blood pressure? Whoever has blood pressure means inflammation of vascular system. Taking blood pressure medication is one way. Other way, you can decrease inflammation of your blood vessels, and dilating the vessels and blood pressure gets better. If you want to have good brain health and good memory, you have to have good vascular system. So you can have this highway, you can have that highway. This highway, that's a small one, causing peripheral vascular disease, leg pain, restless leg syndrome, high blood pressure. Every single chronic disease is starting from inflammation of vascular system. And with exercise, we can make a strong heart, we can decreasing inflammation of the vascular system, and we can make our heart and our brain happier and healthier. Second is about BDNF. When I was in med school, we were taught when brain nerve died, is done. Nothing can replace that. Right now, they are saying this is not true. Me and you, everyone in this room, we have ability to producing nerve cells until last day of our life. There are many, many factors increasing neurogenesis, making more nerves. One of them, the most important one, is BDNF. They call miracle group, making more nerves and make our brain mass bigger. At age 40, listen to this point, at age 40, every 10 years, we are losing 5% of our mass at age 40. After age 70, it's going to increase more. Exercise with increasing BDNF, making this decreasing less, make brain be bigger and less declining. BDNF has the second effect. But before I mention that, I would like to talk about nerve cell, what exactly we are talking about nerve cells. Nerves, they are this type of picture. There is a small branches, the yellow part sticking out. They are receptors. They are receiving message. Going to the body of the cells, and the big long branch, they call axons. They are transferring those message to the bottom of it. It looks like a launching pad. They are sending information to another nerves, sending that message. Some of them, they have coat, upper part, if you see that gray part, they have coat. Some of them, they don't have that coat. That coat is part of the fat. That's why we are saying good fat is important for brain health because of that myelin. How they transfer that message? Like this. BDNF making these branches more dendrites and make more connection better. And now with the electronic microscope, they are actually seeing what's happening in the brain when these two nerves, they want to connect that. And this is the picture of it. See how dynamic it is? And they're making those roads, they're making those connections. Exercise, increasing BDNF. Let's do it again. And making that connection more, faster, better. That's why if somebody has a stroke, they're losing some function, they start some physical therapy right away to make those connections sooner, faster, better with increasing BDNF. And now, even in Petri dishes, they are putting BDNF molecules, and the right side is with no BDNF. The left side is with BDNF. Is more branches, more access. So if I'm not remembering things, if my message is not passing through, if I have more dendrites, I have more way to go, and I can pass my message, and I can remember that. Imagine if you are in a traffic, you're stuck, there is no way to go, you don't remember this message, you don't remember the name of that, you don't remember what you have to do. But if you have more dendrites, more exercise, more BDNF, so you have more branches to go, and the message can be transferred. The third part of exercise effect is communication between one part of the nerve to another part of the nerve. They call synapse, launching pad. And there are packages of molecules they call neurotransmitters. They are sending messages. We have many neurotransmitters. Epinephrine, norepinephrine, serotonin, dopamine, GABA, acetylcholine, glutamate, and even endorphin. If you want to be healthy, you have to have these neurotransmitters balance. Any kind of imbalances causing problem. If, for example, I have problem with dopamine causing Parkinson. If I have problem with serotonin causing anxiety and depression. If I have problem with dopamine, restless leg syndrome. If I have problem with acetylcholine, I don't remember, Alzheimer and dementia. If I have problem with glutamate, seizure. Exercise, make it this balance. If you have good epinephrine and norepinephrine, give you power. If you have good dopamine, make you happy. The way we are playing with our cell phone, we are increasing our dopamine watching TikTok or Facebook. This is dopamine release, and we get addicted to it. Women's shopping is dopamine release. Serotonin makes your mood elevated. Acetylcholine and glutamate make you more concentrated and executive work. GABA make you relax. And endorphin is a good feeling hormones. Exercise with balancing hormone making you feel better. That's why after exercise we feel more relaxed. It's exactly opposite of a stress. A stress shrinking your brain, decreasing your neurotransmitters, decreasing your BDNF, and exercise, balancing your hormones, make you feel better and increasing your BDNF. Next one, diabetes. Last time I mentioned, people with diabetes, they have 50% more chance developing memory problem and dementia. Now they are saying dementia is type 3 diabetes. And the simple way is we have insulin sitting on receptor. As soon as insulin sitting there, the door needs to open on this, the blue one, and sugar goes in. This is not very simple. This is very complex procedure. All of the signals coming from inside to outside open the door or no. They are calling insulin signaling system. It's very complex. And if this system does not work, we develop cognitive impairment. That's why if you see older folks, they have more craving for sugar. And they keep having sugar, but they don't have that effect because this sugar doesn't go in. And they keep having it. That's why when we go to nursing home or memory care unit, those people, they are hoarding those cookies and brownies because they feel like they need that. Whatever you have craving the most, you have to avoid it first. Imagine type 3 diabetes look like a Black Friday. We all are standing outside, the door is not open. The door for insulin is not open, the sugars goes in. They called diabetes. Next one, exercise affect mitochondria. Mitochondria is a small part every cell have, is engine of our cell. We all have half of our genes from dad and half of our genes from our mom. But mitochondria has their own genes. And all of those genes we are inheriting from mother. And they have their own genetic material. It's very complex. They are making our energy. We are giving water, we are giving food, they are giving energy. Exercise, increasing your mitochondria. When you have more mitochondria, you have more energy. Exercise, making more mitochondria, then you have more energy. And it's very complex. I wanted to just give you some idea. This is human biology. Every single cell has this chemical reaction. And when you see that star, you see a little bit of circle here. This is the Krebs cycle. We all hated when we were in med school or when we were in biology for that ATP and NAD and NADH2. We hate to memorize that. And this is, in simple way, is this. Water, food, and oxygen translating to ATP as a currency of energy. And some cells need more energy, like muscle, like liver, like brain. We need more mitochondria. Right now, they are saying all of the brain disease, ALS, MS, Parkinson, Huntington, dementia, all of them, they have some problem with mitochondria. With exercise, you can make your mitochondria optimal, make your energy better, your memory gets better. Next one, exercise enhancing your immune system. Imagine these groups, they are your intelligence service, your NSA, There are FBI, there are cops, your immune system. They are trying to make you protected. There are many, many actors here. Some of them, they're B cells, T cells, and all of them, they are protecting you. I just mentioned one thing about T cell. We have many types of T cell. They call T suppressor cell, T helper cell. We have two types of T helper cell. T helper 1, T helper 2. T helper 1 usually fight against microbes, viruses, and T helper 2, they are against inflammation, fire, something to dump it down inflammation. Unfortunately, they have limited budget. If you have too much inflammation, we have to have more T helper 2, so they are not hiring T helper 1. Maybe in the body, because of inflammation that we have, 9 T helper 2 are there. There is 1 T helper 1. Or maybe we have 10 T helper 2 and no T helper 1. T helper 1 is against viruses and microbes. That's why after COVID, United States has the highest mortality in the world. Why? Because we are inflamed community. We have inflamed body. We are not active. Our food is inflammatory. Our environment, water, food, air is all inflammation. And that's why they were trying to dump inflammation down. COVID hits, there was no T helper 1. That's why we had high mortality. Exercise, balancing T helper 1 and T helper 2, making your whole immune system lean, mean, quick, and ready to go for any kind of insult. Exercise and musculoskeletal system. I can talk about this long time. I'm just making few points. 1, make your bone strong. We all heard about osteoporosis. But bone is not just simply bone. Bone is the center of all of your immune system, all of your blood. All of your blood, they are producing in bone marrow. The second one, musculoskeletal, muscle. The first sign of aging is muscle atrophy. They are saying, if you want to have a good brain mass, you have to have a good muscle mass. And muscle mass and brain mass correlated. Few things I wanted to mention about musculoskeletal and integrity of our structure. If we have exercise, especially balance and stretching, making good structures and basically integrity of musculoskeletal, we are not going to have too much the head go forward. What happened? Affecting our airway, making ourselves more prone for obstructive sleep apnea, and I said last time, is a danger for brain. And also, those highway 80 I mentioned, they are going through your brain, they are going to be stretched and causing a lot of cerebrovascular accident. So when you are exercising, somehow you have to put something in your program making your structures straight. The second one is about that kyphosis. This kyphosis, putting pressure on lung, causing restrictive lung problem, and when the lung is under pressure, affecting heart under pressure, and then subsequently go towards brain. So pay attention to the whole integrity of the body, the way we sit, the way we stand, and that's why we have to pay more attention to that. And GI. This is very important part. It's not simply we exercise so we are less constipated. Many years ago, they were saying the first sign of Parkinson is tremor. We thought. Right now, they are saying 20 years before this tremor, the first sign of Parkinson is constipation. We have to have bowel movement every day. Number one, few things I wanted to say really is an aha moment. Those neurotransmitters I talked to you guys is good for overall health. 25% of neurotransmitters producing in brain. 75% of neurotransmitters producing in GI system, in your belly. And that's why for 2,000 years, we were saying, my gut told me. So now they are talking about your GI system is your second brain. Many people believe our brain is second brain, and our GI system is the first brain. So you have to have your GI health with increasing hydration, increasing bowel movement, and good microbiome. Exercise, improving your GI health. And sleep. Of course, we are going to talk about that next module, but we all know that when we are exercising, how beautiful, restful sleep we can have. So, what type of exercise? We have cardio, we have high-intensity interval, we have strength training and resistance, and we have balance. Cardio. I'm a big fan of walking. It's the most ancient and the most modern exercise we can have. Especially for older folks, is not going to put too much pressure on our knees, and our heart rate nicely goes up, and we can have all benefits of exercise with simply walking. But whatever you're comfortable, jogging, biking, swimming, running, whatever works for you. Start low and go slow. How much exercise we have to do for cardio? They are saying 150 minutes per week. You can make 50 minutes a day, 3 times a week, or you can make 30 minutes a day, 5 times per week. How? Moderate intensity. What that means, moderate intensity? 65% of maximum heart rate. What's the maximum heart rate? 220 minus age. Imagine, for example, somebody is 70 years old. 220 minus 70 is 150. 50% of 150 is 75. 60% is 80. So if your heart rate is around, if you're 70 years old, your heart rate is around 80 to 85, you're good to go. But always you have to talk with your doctor to see you are eligible for some sort of physical activity, especially cardio, number one. Number two, if you're taking any kind of beta blocker to keep your heart rate low, you have to talk with your doctor. Maybe you are not reaching to that point because of that medication. That's why it's necessary you talk with your doctor. Second one, resistance training. Recently just came out about resistance training and muscle mass and brain mass. They had one in Sydney University in Australia, and they saw 65% decrease chance and risk for dementia just with simply resistance training and strength. Third one, HIIT, high intensity interval training. You go to a slow pace. Initially, you start warm up. You go a slow pace, fast pace, a slow pace, and fast pace. You just play with that. This is excellent for mitochondria, and for male is excellent increasing testosterone level. And the last one, the most important one, is balance. Balance is creeping on us, is very sneaky. And we don't know how much we are imbalanced until something happens, we fall, and then we realize how bad shape we are. This is my most important one. If because of the age, because of our muscle, our flexibility, our eyes, our ears, if you have some dizziness, vertigo, ringing in your ears, lightheaded, dizzy, always work for vestibular training, vestibular exercises, and balance training. This is very important. What is the best time of exercise? The best time of exercise is the time you do exercise the most. Whatever works for you. Some people works early in the morning. Some people later on in the afternoon. But if you want biologically have the best use of exercise, you have to do early in the morning. More, I talk about this in sleep module. And the best of exercises is playing games and dancing. Why? It's not just simply exercise. It's cardio, it's balance, it's resistance, it's social connection, it's a stress reduction. You have to memorize that. So you are hitting a lot of points with simply exercise. And with this playing games, they are saying you are reversing your aging and you are delaying your aging. There is some secret of playing. Your imagination gets more and your age reverse. So whatever works for you guys. I wanted to mention about fall. Always I tell my patient, that's the first killer. Every 4 people after 65, one of them fall per year. Women's, they are endangered twice. And every 11 seconds in the United States, somebody from fall is in the hospital. And every hour, 3 people in the United States dying from fall. 19 minutes, 1 person. That's all I have. And so exercise is important. Making more blood, making more BDNF, making more communication. And we have different type of exercises and whatever works for you. And try to take yourself from a state of doing to a state of being and be active. That's all I have today. Any question? $220 minus age. Age. For example, if I'm 70 years old, 220 minus 70 is 150. We want 60% of that is around 80. You go low and building up slowly up. No, highest as much as you tolerate that. The best one, you go to 75, you go to 80. But we have to building it up. For this particular age, they are saying between 50 to 70. 65 is that sweet spot. Brain drive neurotrophic factor. Sorry, I should add that. I'm sorry. Brain drive neurotrophic factor. NEUROPHIC factor. Your location is Muscatine School Administration Office, Muskie Room, 2900 Mulberry Avenue.
For next time, we'll be at a different.
Yes, sir.
What is the best natural thing that you can do for high blood pressure?
Beside all of those stuff, there is some natural, for example, high magnesium. Magnesium is basically vascular relaxing. I personally, if you want to take arugula, do you know what's arugula? Is a vegetable. Ivy has it. Arugula is very nice vasodilator, and they are saying arugula is a new Viagra. They are vasodilator, and they are decreasing blood pressure down. I had last night. When you go walk in the right side.
What time is that next?
Is the same, I believe, 5:30 to 7. Yes. Yeah, it's 5:30 to 7. Thank you, everyone, for your time.
Thank you so much.
Thank you.